Now, let's move on to another province where there's been a surge in COVID-19 cases there as well, that of course being the Northern Cape. For more, we are joined by reporter Margaret Mothibi. Margaret, welcome to SA Today. Thank you indeed for joining us. We just saw Gauteng. We know that numbers have increased there. South Africans have been asked to go back to the basics, non-pharmaceutical measures to prevent the contraction of COVID-19. Wash your hands, sanitize, wear your mask in public. The numbers in your province are not looking good as well.
Good afternoon, Thabiso. Indeed, I think there has been concerns since April. We've been reporting that there were concerns that there are rising numbers in the Northern Cape, Free State, and also Northwest. But what we've seen this week has been quite a cause for concern. The Minister of Health, Dr. Mothibi, spoke about it. For the first time in the Northern Cape since COVID started last year, you saw overnight 421 people being infected with the virus. And even yesterday, they reported that they have 399 new cases. That has never happened before. And yesterday and on Thursday, we had the Portfolio Committee on Health, which was visiting the province ahead of the second phase of the vaccination rollout. What they're saying was that it's alarming that in this very small province where you have a very small population, you have an infection rate of 67%. That's happening like weekly. So there is serious concern, and there is a lot of active cases as well around areas in Kimberley and also in certain districts.
In terms of your districts, which is more concerning right now for the health departments in the province? Which district looks as if it's getting out of hand?
So basically, the district where you have serious concern is what we call the Francis Bart district. So that would be your Kimberley area, your Halishiwe area, areas around Warrington. So you'd understand in around Kimberley and Halishiwe, that's where you find bulk of the people in the province. And there's a lot of activity in terms of this is where you find government offices. So a lot of activity happens actually in the province around here. And I suppose that's why you'd find that you'd have a lot of active cases in this particular district. So currently, like I was saying to you, that we have over 5,000 active cases as we speak.
With regards to the vaccination process, the rollout thereof, you did touch on the fact that there's concern that it's not going as briskly as possible. With the second phase beginning Monday, what is the mood on the ground? Does the health departments in the province feel that they'll be able to overcome what is expected to be a large number of people racing to get the jabs in their arms?
So basically, two things came out as we wrap up the week. So yesterday, the health MEC in the province, MEC Maruping was talking, and he was saying that they're quite alarmed because there aren't a lot of people that are taking up to actually registering their elderly parents or registering themselves if they are over 18 with comorbidities to get the jab. So they were saying that what they're going to do in the coming week, because they've done the door-to-door, they've tried to tell people that you need to actually get yourself ready for the second phase. So from Monday, they will be going to old age homes. They'll also be targeting SASSA pay points where they can, as a Department of Health, go physically there to register people. And the other thing that was raised by the Portfolio Committee on Health, they were saying that they're concerned about the remote areas where the storage is not as adequate as they'd like it to be, because remember they say that with the vaccine itself, it needs to be a certain temperature and the storage needs to be adequate. So there was concern about it, but their feeling was that if the province can swiftly move to address those issues, we will be able to actually roll out the first phase without many problems or a lot of hiccups.
That was one of the issues when the government was thinking about which vaccine to buy, to get for South Africa. So you're saying there's issues with, I think we're using the J&J Sisonke project. Is there issues with cold storage for that vaccine? Is that what I'm hearing you saying?
So the Portfolio Committee was saying that with the remote areas, so you must understand that with the Northern Cape, it's a huge province and it's a rural province. So you find areas where it's too far flung. So there was concern about what do you do about villages in like your John Taulo Gauteng district, that would be your Kuruman areas, which has a lot of villages. So they were saying that the department needs to sit down quickly and come up with a plan in terms of, do you transport those people from the villages to the nearest city where they can get the jab, or what is the plan and what's going to happen? Because reality is you wouldn't find a cold storage facility at a village that is 500 kilometers, for example, from Kuruman. So they need to sort of like sit down quickly and find a plan in terms of how are you going to address that, because that is a reality in the province.
Margaret Mothibi, thank you very much indeed for joining us. We'll catch up with you hopefully by Monday as well, right? And I said today, as the day rolls out, as you're saying, Monday they're expected to go out and visit old age homes and try and get people registered for the vaccination process there in the Northern Cape. Margaret Mothibi speaking to us from the Northern Cape on updates on the COVID-19 cases. Just to give you numbers there, as far as that province is concerned, as you saw on the screen a short while ago, Margaret spoke about the Francis Bart continues, that district continues to record high infections. In fact, as of yesterday, more than 100 cases were recorded. That is 3 days in a row that has happened. Yesterday, they recorded 157 cases, followed by Pixley Kasembe with 107 cases of COVID-19 in the Northern Cape. The ZF Mgau district, 68 cases, JT Gaetsiwe, 52 cases, and Namakwa, 14 cases. You heard Margaret say this. So there is concern there. The second leading province, and as far as South Africa is concerned, over 5,169 cases reported yesterday, following on the lead story that we had with Gauteng, with over 7,000 cases of COVID-19 recorded in that province. Now, as South Africa